Help us commemorate World AIDS Day. My name is Philip Lotzer. I'm the Executive Director of the AIDS Center of Queens, which is the lead agency for the HIV/AIDS Care Network that provides services throughout our borough. To begin, we have with us Dean Meletius, who is going to welcome you to this fine institution. York College has always been there, has been hosting this event and others for many years, and it's our privilege to be here as well. So, good evening, come on.
Good morning, everybody. Good morning, panelists. On behalf of the President of the College, Dr. Marcia Keys, here administration, Provost Ivor Griffith, Vice Presidents, the faculty and the students of the college would like to welcome you, welcome the members of the community, welcome the center, welcome the panelists for this event that is taking place every year at the college in commemoration of the World AIDS Day. Your college, as a member or one of the units of the university, is committed to providing to be a resource for the community that it serves and the students and all of the members and the impact that it has at in the area of Queens and Jamaica and the Southeast Queens. We would like to continue doing this event every year, and the fact that it's happening every year here is an indication of our commitment. Our faculty, our students are a resource and service providers for the community. They help provide information and other resources to the community, and we would like very much to start the proceedings of this panel without any other discussion. Thank you.
Good morning, everyone.
Good morning.
I'm Rosemary Lopez. I'm the Associate Executive Director for Programs at the AIDS Center of Queens County. We're the lead agency for the network, along with Deborah Green, who's a co-chair of the network, who will be speaking, also Natalie Rubio-Torrio, who will also be speaking. I wanted to thank you all for coming, and I also wanted to thank York College for sponsoring this again this year. And I wanted to just do a few words about World AIDS Day today, as we see it. You know, over 1 million people are estimated to be living with HIV here in the United States. Worldwide, it's over 33 million. On this World AIDS Day, we are all filled with hope and concern. We are 28 years into this epidemic, and you're 28 years doing this work. And the virus is still affecting new populations. Stigma and discrimination still exist. The 2009-2010 World AIDS Day theme challenges discriminatory laws, policies, and practices that stand in the way of access for HIV prevention care and support. Universal access for all and human rights is really the theme this year. The human rights of individuals with HIV, especially women and girls, are still being violated, as well as men who have sex with men, injection drug users, and sex workers. This discrimination has to stop. General Ban Ki-moon, Secretary of the United Nations, has called on all countries to live up to their commitment to enact legislation outlawing discrimination against people living with HIV. On this World AIDS Day, let us remove these punitive laws and practices and end discrimination. Let us also act on HIV prevention. For every 2 people put on treatment, 5 are newly infected. Worldwide, we can eliminate mother-to-child transmission. We can empower our young people to protect themselves from HIV. We can stop violence against women and girls and the LGBT community. We can protect drug users from becoming infected with clean syringes. And we can reduce sexual transmission of HIV. We have made some gains. After 22 years, President Obama is finally letting people into the country that are HIV positive. But we still must focus on the most vulnerable populations. We need to increase our funding rather than decrease our funding to the agencies in order to do the work that we do. We need to take action, get tested, practice safe sex, talk about prevention, not only with our family, friends, and colleagues, but in the community. And we must provide support to people who are living with HIV and AIDS. We must take on a new HIV/AIDS campaign, which puts priority on life and dignity for all. At this time, I really want to thank all our network members, our executive committee, our consumers who work tirelessly all year long to put this at the forefront. And I want to take a moment to really just have a moment of silence for all of our family, friends, colleagues, community people that are infected and who have died from the virus. Just take a minute. Thank you. Okay, thank you. Debbie is going to speak.
Good morning. My name is Deborah Green. I'm from Queens Hospital Center, but I'm also a co-chair of the network. I'm not going to bore you with the history of the network, although we have been around for many years, but I want to give you a bit of an overview. Okay. Currently, the network has 96 organizations, plus consumers who are either affected or infected with the virus. We meet on a monthly basis to discuss what this community needs. Okay, this community being Queens. It's important that we get together to share information, to share concerns, and it's a place for us to have a voice in the community, and so we can have our voice shared with people like those on the panels, with legislators, with people in power. Let me read you the from the mission statement. It is the mission of Queens HIV Care Network to enhance the coordination of existing HIV/AIDS services, to identify services gaps for people living with HIV and AIDS, to increase community awareness of HIV and AIDS services, and to develop strategies for expanding HIV services for the borough of Queens. I also would like to thank all the members of the network who have helped each other in improving the services in Queens. Okay, I'm going to introduce my co-chair, Natalie.
Thank you. Good morning, everyone. Is this working? Okay. So I'm not going to take too much time because I think that Rosemary and Deborah did a wonderful job giving a little bit of a history and why we're here and a little bit of a background on the network. But what I do want to do is, first of all, thank the panelists and thank all of you for making it out to Queens. I know there's activities all over the city today, and you guys chose Queens to come out to, the most diverse borough, I think, in the country. Am I right? With over, 150 languages spoken in Queens. Okay, so that says a lot, I think, for the people that are also being affected and infected here in Queens. It's not just one segment of the population, it's a lot. And I think Queens is the most diverse, like I said, but also with a lot of the recent immigrants coming from all over the world. So we really have to look at it in that way. I'm the executive director and co-founder of Voces Latinas, an organization that targets and really reaches out to immigrant Latinos in Queens living with AIDS or in HIV or at risk. And what we take this population very seriously because we don't know the information that people are arriving in this country with in terms of HIV and AIDS. So I just had to say that because Queens, I think, is just so full, it's just so diverse and for people from all over the world. So I thank you for coming here. And also I have a question. Does anybody know, or has anyone heard of the National HIV Strategy? Can I just see a show of hands? Okay, not that many people. So I'm going to tell you. President Obama's administration, national HIV and AIDS policy people are coming here to New York on Friday. And they want to hear from all of us that are involved in the field of HIV and AIDS. This is an opportunity for all of us to get out there, to either submit it in writing, or I'm not sure how it's going to go, these like town hall meetings nowadays, but even if you can't get up there and speak, you can submit your testimony in writing and have it be heard. I personally...
Online.
And online, yes. I personally, on behalf of Voces Latinas, I have submitted a testimony online, and I got a response from Washington. So they are getting them, they are reading them, and they are putting them together. So I would encourage as many of you to come out. It's on 168th Street, Columbia University, on Friday at 6 p.m. Rumor has it that President Obama might show up, or Michelle Obama, I don't know. But the important thing is to get out there, even if you can't get out there, to submit something online, and just make yourselves be heard. Make this be heard. I think that we have people in the room here have a lot of important things to say when it comes to this illness, and we have to let Washington hear. Okay. So with that, I thank you all for being here. It's a full day. We're going till 5. Not the panel, but we're going till 5. Okay. And I'm going to pass it back to Rosemary Lopez. Thank you again.
Well, without further ado, I'm going to introduce my boss, Philip Glotzer, who is the moderator for the panel.
Thank you. No, that's okay. We don't have to. In the interest of time, you really don't care. So let's get to the people that have something really interesting to say. We have a really esteemed panel here, but to provide us with a keynote address is our local city councilman, the person who represents us in Southeast Queens. He is a long-time advocate and activist for people living with HIV/AIDS. I can tell you, as a CEO of an organization serving people with AIDS, he is my go-to guy in New York City. When we have a problem, we go to Councilman Leroy Comrie. He is always there when we need him, and he's always fighting for the cause. So it's my privilege and honor to introduce to you, and so if you haven't known him, he's our local councilman, Councilman Leroy Comrie.
Good morning, everyone. Good morning. It's good to see all of you here this morning. I want to thank your college and all of the panelists and all of the participants that will be part of all of the activities today. As today is World AIDS Day, there are, as the earlier speaker said, activities going on all over the city, but it's important that we do have a large contingent here at York College and in Queens, because Southeast Queens is one of the major epicenters for the rise in AIDS, especially among young people between the ages of 14 and 21, and among older people. Now, what I found out serving in the city council is that now a lot of older people, ages 50 to 65, are getting AIDS for the first time. So we have a real crisis in our community. We have a real crisis in the Jamaica and Southeast Queens area, and it's something that we have to work hard to address at every level. But to definitely to, hopefully, in a difficult budget time, we have to raise your voices higher than ever to fight for the limited dollars that will be available. Now, I could read to you all of the statistics that the City Council has been providing to try to bridge the gap, but it doesn't really bridge the gap between what we lost in Ryan White funding on the federal level and to what the real need is. So, you know, I could tell you about the HIV/AIDS Communities of Color money that we put in, the HIV Prevention and Health Literacy for Senior Program, because as I said, we discovered in the council that the senior population is getting AIDS at a higher level than before because of people that are coming back into the community and not telling people what their lifestyle was when they were incarcerated or what their lifestyle was when they were in other places. We have a HIV faith-based initiative, which we do over $2 million a year for. We have the initiative for seniors is $640,000. The Harm Injection Uses Alliance money is that we still have been providing, but it's not enough money to deal with the issues out here. What I would want to implore to you today is that in a negative budget, we have to be more active than ever. You know, hearing from Phil is nice. I always return Phil's calls, but making sure that when there are any meetings, such as the meeting on Friday with the President's new health team that's coming out to look at this situation, every person in this room should be there or be online or be there in person to show in a show of force the problems that we have with AIDS in New York City. New York City is an epicenter. We cannot allow an opportunity to have federal representatives here and we not express our voice. It's good to do it online, but it's more powerful to be there in numbers in person. And it's good to write a letter, but people need to know on a regular basis by writing letters to your elected officials, by writing letters to the president, by writing letters to editorial boards, by working with this alliance here, which is a strong alliance to try to get outreach out, that we need to get dollars and services more than ever. You have my commitment to do everything I can on the city council level. The reason I'm going to run out here now is because we have 6 new city council members coming in from Queens. And we have 2 members that actually only started this year, Councilmember Ulrich and Councilmember Crowley. And they're doing orientation today down at City Hall. So I need to go down there and orientate them to what I want to make sure they focus on in Queens. Now, I've been privileged to be the head of the Queens Council delegation, and that's helped me. So I need to make sure that and they've already intimated that they'd like to keep me in that position because they know that I will be bringing them the information and concern that they need to have so that they can be effective. But one of the informations that they need to have, a new council member from Long Island City, a new council member representing the Jackson Heights area, a new council member representing Howard Beach and the Rockaways, the Bayside area. So they all need to know that they have AIDS problems in their areas also, that they have people that are living in their communities that are not telling the truth about their lifestyle, and that the rates of infection are going up everywhere. So I'm going to sneak out of here. Well, not sneak out, but I'm going to leave. You can't sneak out of this one. But I'm going to leave and ask you to please consider raising your level of activism because it's important now. When dollars are diminished, people hear the loudest voice and the most persistent voice. And I know it's frustrating, but it's important. I know that you always don't get the response from everybody that you like to get, but you need to let them know how you feel, even if you don't like what they have to say or how they treat you. Because if they don't know your passion, if they don't know your concern, if it's only writings on a piece of paper, it's not effective. I'm not going to give everyone, but everyone on the panel, I'm not going to waste time to do it right now, but everyone on the panel is getting a citation to thank them for their efforts in this fight, for being here today. Thank the AIDS Center of Queens County for moving to Jamaica and for everything that they're doing to make sure that the coalition works. Enjoy the rest of your morning, and I hope to see all of you at another time very soon. Thank you very much.
All right, thank you, Councilman, for getting us going. It's a good pleasure. We have another dignitary in the room, and then we're going to start with the panel discussion. Representing Congressman Gregory Meeks, who is also the congressman from this area. Congressman Meeks is the activist that we go to in Washington whenever we need anything for HIV/AIDS, and of course, Councilman Comrie handles New York City for us. And Mrs. Simone Meeks is kind enough to come today because this is something that's really dear and true to the hearts of not only the congressman, but of course his wife, Mrs. Meeks.
Good morning, everybody. Good morning. So I'm going to follow the councilman's lead, and my husband's staff person is here. I'm about to be in trouble because I'm not going to read the proclamations. Please, but please bring them here going to hand them to you. I wanted to be here because the whole AIDS movement has been important in my life. It is a personal struggle, both in my family and in the work that I do. I work in healthcare at the New York Academy of Medicine. And I have always cared about healthcare, and anybody who cares about breathing should care about healthcare. The reason that I wanted to be here is because I want to say something that we keep talking about. The AIDS in all communities are rising, and indeed they are. They're not rising like in the black community. Not even in the Latino community are the numbers rising like they are in the black community. When you're 14, 15, 16% of the population, whichever one you want to pick, but the AIDS cases are 50% of you, that's a problem. And I come from a family that has West Indians and Puerto Ricans. I have the mulatto, crazy, everything in the family. The true American story, yes, you know. We come from a place where people keep secrets, you know. You look at your cousin and you know your cousin is not a heterosexual. And people are like, oh yeah, did you meet his girlfriend? The fact is, that kind of behavior is what is killing our community. And when we talk about tolerance, it's not just tolerance so kids don't fight in school. It's tolerance to allow people to be who they are everywhere that they are. When they're in church, when they're in family, when they're alone in their room, when they're with their cousins. Let your family be who they are. It is the only way we're going to survive this. And that's why I wanted to be here this morning. I thank you for this forum. I hope the young people in this room will take a different tact about how they talk about human sexuality. We, in my generation, have not done a good job. We have not done a good job. And those of us who are here that are part of my generation, we need to do a better job. And when your pastor is only talking about AIDS during AIDS Awareness Week, every day is AIDS Awareness Week, because 50% of the population is suffering, and too many people in silence. You find out someone is infected when they're on their deathbed. That is unacceptable, and you should be outraged by it. And yes, Congress is doing its part, but we don't solve bigotry through legislation. We don't solve tolerance through legislation. We don't say who we are through legislation. People's behavior changes things, not legislation. Have a good day. Thank you.
I want to thank Mrs. Meeks for keeping it real. She always does every year. And also Mrs. Ida Smith, who is here, who is also an advocate, always at us at Congressman Meeks' office. Okay, I'm just told that we have to vacate here at 11:45. So in the interest of time, because we want to have some dialogue later, and we have a really esteemed panel here that I'm looking forward actually to listening to. So rather than listening to me, I'm going to turn the microphone over to our panel. They will introduce themselves, give a brief presentation, and then then I'll help moderate just the question and answers that will be coming later on, we hope, and we can hopefully get into some dialogue. So I'm just passing the mic down, and you're on your own, guys.
Hello, everyone. My name is Jahi. I'm currently a York College student. I'm the president and founder of the Urban Enrichment Society here at York College. What we basically do is we make our best effort, or most conscious effort, to do what's necessary to combat the things in the urban community that keeps us kind of stagnant. So we do have a committee that is focused and geared towards healthcare and health awareness. So our job on this campus is to organize York College students and students from other campuses to then push a message of positive health awareness so that we can then generate what is normally the movements that start from college campuses. So that's basically what we do on this campus. Any questions in regards to that, you could please feel free to ask.
Good morning. Good morning. I'm Reverend Stacey Latimer. I'm the CEO and founder of Love Alive International. And we are there to empower those oppressed by cultures and traditions, systems, religions that impede their personal and physical well-being as pertains to HIV and AIDS and other disproportionate health disparities that we have in the communities. I'm also a pastor, Love Alive, yes.
I'm sorry, guys, we understand the microphone isn't working too well, a little technical problem, but I've heard Reverend Latimer doesn't need it.
I
I do apologize. They're still trying to get the equipment together. Unfortunately, the person that was supposed to do it was out sick, and they're up there now sculling, so hopefully it'll come, but
You know, I've heard all the panelists, so you really will.
do the best we can. Talk as loud as I do.
Also, as a pastor of the Unity Experience in East New York, that's part of what I do. But really, you know, when we talk about universal health care, and everybody, in a sense, understands that everybody should have access to care, period. But when you begin to think about what's going to get that, we talk about legislation and talk about laws and all of that, but the key is perception. How do you perceive people who are different than yourself? How do you perceive people that don't live in your neighborhood? How do you perceive people that don't live in the hood? All those different things. I think my job has been over the last 17, 18 years is helping people with that perception. Being a 22-plus year survivor of HIV/AIDS or of an HIV diagnosis, and being able to openly talk about that, being able to talk about my relationship with men and all of that, even as a pastor. As the sister was, Ms. Meeks was saying earlier, about being honest and being open and not having all these secrets, because that is a part of what's killing us. And even if you come from a religious community, sometimes we have to think to ourselves. We say in the religious community that truth is important to us, but sometimes I think it's more about conforming than about being truthful. And so we have people living in darkness, don't know that they're living in darkness, but anytime you've got to hide something, it's living in darkness. And so when we begin to talk about loving ourselves, it's loving myself entirely, of totally who I am. And for those in the room who are struggling with their sexuality, because that's a major issue at this point. And I'm not going to get into it because I'm not here to steer you away from anything that anybody's taught you, whether it be your parents or whether it be your pastor or any of that. But what I can say to you, because we've got so many people who are struggling so that they're committing suicide, and they're doing all kinds of things in terms of trying to deal with what is reality to them. But on the outside, there's this other entity, these other pressures that tell you you're something different than what you feel on the inside. So there's this major war going on, and we've got too many young people dying. We have too many older people as well who are committing suicide. I myself, back in 1983, tried to commit suicide over some of those same issues. But it's really about getting to know who I am. From the time that I was born, I was subject to my family's desire for what they want from me, subject to my community's desire for what they want from me, subject to the church's desire for what it wants from me. But at some point I have to come to realize that who am I? And what do I want from myself? And then being willing, you know, because you can live your whole life, 40 years old, and find yourself in a place where you don't know who you are. For real, who you are. Find yourself somewhere in a crack house and wondering how you got there. You know, and I've done that too. You know, had 5 years of just smoking crack because I couldn't deal with my reality, because I was too busy trying to live somebody else's reality for me. So I'm saying all that because out of all the different things in our community that block us from really dealing with HIV, because there's so much that's illusion. We live in illusion half the time. And it's okay to live in illusion if that's going to keep you sane. But at some point, you got to deal with reality. And reality is that HIV is here. And if you're at a point in your life that you're just very sexual, you need to deal with the fact that you're playing Russian roulette. Even if you incorporated some safe sex practices into your life. Because at some point, you know, being honest, as I deal with young people, as I deal with old people, you know, across this world, you know, at some point, you know, with all the drugs and with all the alcohol that's involved in most of our lives, you lose sight of being safe. That is, safe enough to keep you 100% from being infected. Because there is only one way to do that, and that's no sex, no drugs. You know, those are the 100% ways. But again, reality check, how many are actually doing that? How many plan to, you know, when you leave the session today, you know, we're doing all this. How many people plan to get high this evening? You know, I don't need to see hands. How many people already got a date this evening that you're already in your mind that you're ready for sex this evening? You know, that's the reality check we need. Inside of that, what have you prepared for that? And if you haven't prepared for that, have you prepared yourself to be sick for the rest of your life? Have you prepared yourself to take medications for the rest of your life? If you have not prepared to do all of that, then maybe you need to go back to square one and think about your plans for the evening. Think about your plans for the next couple of years of your life. Because I myself, just like anybody else in this room, at some point in my life did not think I would be HIV positive. Wasn't doing anything. And see, and again, we talk about perception, and I'm getting ready to close because I can stand up here forever. You know. But, you know, perception. I didn't perceive myself as somebody that would be contracting HIV. Came from a good family. You know, I've had many years of college, good jobs, grew up in church, all, as they say, the right things. But then here we are, you know, wrestling with who I am on the inside. Everybody else think everything is hunky-dory. And then when I tried to commit suicide, everybody's like, what's wrong with him? You know, he got so much to live for. Why he doing this? Because nobody can see the war that's going on the inside of you. Nobody understands the peer pressure and what it does to you on the inside of you. When you've been taught at home not to have sex, and you see sex in one particular way, and everybody at school just about that you're dealing with is talking about how they're doing and what it feels like and all that kind of stuff, and then your mind wanders over here and wants to do that. All that war that's going on the inside, and you can't find somebody to talk to help you deal with those pieces. Reality check. Reality check. Look at me. And now on, you can say that you know somebody who's positive. And if I hadn't told you, you would never know. So I could be that brother at the park that you just met that's so cute, so fine. On the other hand, I could be that sister that's so cute, so fine. And it gets so hot that we don't get a chance to ask those important questions. When was your last HIV test? Not whether you're positive, when was your last HIV test? Was it yesterday? All those different things.
Thank you, Reverend. Ms. Reddick, please.
Good morning. I am Yvonne Reddick, District Manager for Community Board 12 that takes in all of Jamaica. And I am, in my district, I have the highest rate of HIV and AIDS, probably in the city. And one of my problems, I'm just going to, and I like to say to Mrs. Meeks, you know, that's my feeling too. We should talk about AIDS every day, not one day. World AIDS Day, because in our community, especially in Board 12, it's something that needs to be talked about every day. And I also minister, Reverend, not you personally, but there's time when a lot of minister comes into my office for one reason or another. And I always say I sound like a broken record, because I feel that the church and the community, we are not doing what we should be doing. And I know, and I continue to say, in this community, we are in denial. We really, really are. We have 3 needle exchange programs in this district. 3, not 1, but 3. And that's saying a lot, all right? We are one of the fastest growing districts of the 59 community board. And that's according to city planning. Since the last 2000 count, we've had an increase 11% in population. And they say that's the largest increase of the 59 community board since 2000, the last census count. It's a district that's extremely diverse. And you know, when I've spoken to some people about the high rate of AIDS, and someone says to me once, well, you know, they can do the numbers any way they want to do it. That's what they are saying. And I'm saying we're in denial. That's not what they are saying. 3 needle exchange program, and the numbers are increasing. And I've been informed that the needle exchange program down on Archer Avenue off of Sutton Boulevard, the numbers are increasing. So some people that know that they need help, they are seeking help. But we need to do more. And one of the problems I have, the programs. You know, I asked some of the programs that, you know, we're addressing and dealing with AIDS and so on. And my question is, where are you doing your outreach? And some say, well, you know, I went to this church and I went to that church. And most of the time, we're talking about the large churches. You know, we need to stop at the corner churches, the next door neighbor churches. We need to go to the laundromat. I know once a month I have a human service cabinet. And the only community board in the city that has a human service cabinet. It held every second Wednesday of the month. And there we have an opportunity to network with each other, to know what different agencies are doing, because there's many in the district, and I don't get an opportunity to visit all of them. But we still have to do more, and we have to educate our community and let them know, as I use that, we have a crisis in our community, and it needs to be addressed more. We have to do a better job. For the young people, you are our future. As the Reverend says, you know, you look at the young men and you look at the young men, look at the young ladies, and who's hot and who's not. Well, you know, we have to kind of cool off there, you know, and think of our health, think of our future. The seniors that's out there, you know, they think they can no longer get pregnant or whatever, and they're having a field day. We have a crisis with our seniors who, they say, enjoying themselves. You know, we have the older females with the younger males, and older male with the younger females, and it is in our country. And I just came from out of state. I was visiting in North Carolina over the holidays. And yes, we brought up the subject about AIDS. And I think all over our country, we do have a problem. And for those of us who's out there, and I call educating others regarding AIDS, we have to do more. And as for the churches, I always use the word, you know, when you open the door and when you pass in the basket on the weekend or whenever you pass it, think about the crisis that we have in our community. And I ask, how many ministers really talk to their congregation on a Sunday, on a Friday, or Saturday about the crisis we have in our community? AIDS. That's the crisis we have in our community. I know we have others. We have foreclosure, we have hungriness, and all of that. But we also have to think about good health. And if you don't have good health, you know, your Mercedes and your mansion and all, you're going to lose it. You're not going to be around to enjoy it. So if there's anything that we at the community board can do, and I know whenever I'm out, this is what I talk about, like a broken record, AIDS, because there is a crisis in this community, all over the country, but in this community with the black population, So we have a job to do, and let's do it. Thank you.
As usual, I'm back again. Probably people will call me the 8th doctor here at York College because I'm the chair for Health and Physical Education Department here at York College. HIV and AIDS is something that we all have been, Phil and I know, trying to see if there's a way we can contain the epidemic. I'm going to go back to another colleague of mine. We all have been fighting this war. Mrs. Meeks, Simone-Marie said, we're concerned about the numbers. And it bothers me being in an academic institution where we're supposed to be coming out with the best preventive measures to see the numbers go down. Instead, the numbers are going up. But we're going to ask ourselves questions. What are the reasons? We're looking at the young ones. Every day you turn around, you see a pregnant teen. They didn't get pregnant with safer sex. It means that they have sex with somebody. So that should be of concern to us. And who did they have sex with? Sometimes we don't even know. You've seen shows where they go in, they do a DNA. One person comes back. 3 persons will come back. We still don't know the father of the baby. That gives you an idea as to why our numbers will continue to go up. We need to begin to look at that issue. The other issue is incarceration. Every time you turn around, our own folks are in and out of jail, in and out of jail. And what happens there, all of us know, whether you believe it or not. And as they come back, they also, the Reverend said it better. What we do among minority men is that we can't wait to get a woman pregnant to show that we are not gay. We can't wait to have children all over the place to show that we're not gay. And that's the issue. That's the issue. So you don't know who the real person is. And all our females are put at risk because somebody is jumping from one woman to the other in order to prove that they are the man. And those are the issues that we need to begin to look at. Once we begin to talk about those issues, then we can see our numbers coming down. The issue of substance abuse becomes very crucial. When you're high, you can do anything that you have to do to remain high. People with a history of substance abuse will do anything. You sell your body, you do anything you want to do, which is so interesting. I remember working with Dr. Prim years and years ago, and we'll be interviewing all these patients of ours, and we'll be asking them, have you ever had sex with men? They'll say no. Okay. What do you do? How do you consider your sexuality? They'll say, oh, I'm a man, I'm the man, and all those stuff. Then you turn around somewhere when you're asking questions, somebody will come in and say, oh, he sells his body to get his crack. But he doesn't see it that way. As far as he's concerned, he's not gay. He just has to do what he has to do to move on with life. But those issues are the issues that we in our community need to begin to talk about. How do people perceive themselves? What do they see in terms of putting people at risk? We need to talk about those issues. Then we talk about our single mothers. It becomes an issue. And I always tell people that if a woman has to sell her body to put food on the table for her little kids, that comes first, HIV or no HIV. So we can talk about everything and give all that information about AIDS and HIV until we begin to talk about self-responsibility, begin to turn around and look at ourselves and what we're doing. Those numbers will continue to go up. And as a teacher, I'm going to defer and wait for questions because I like the question part of it. And my last point is we need to talk to our kids. They turn around and believe that because all these medications are out there, that we have actually found cure for AIDS. And therefore, they're not listening anymore. There's a cure, and they'll always tell me in my face when I'm talking, what about Magic Johnson? Look at how big it's getting. Therefore, there's a cure. You don't know what you are talking about. The good Reverend explained to you. If you know how many medications you have to take a day, if you know the side effects of the medication, if you know your good and bad days, believe me, you want to remain HIV negative. So I wait for the questions. Thank you.
Dolores Henley, and I'm a member of the Queens HIV Care Network, and I'm positive. I had a problem with fibroids, and I was constantly bleeding, and not understanding, they wanted me to go and get a transfusion in '98. I told them no, but I was on my last leg. My hemoglobin was 4.8. I was almost out of here. So I had no choice but to go and have the blood transfusion. And I questioned my doctor, and he said, but you have to have it. And I'm like, okay. So I went and had the transfusion. In '98, the blood's supposed to be fine. And 2 years later, I get very sick. I'm in the house with a 3-year-old, and I'm like losing it. I'm seeing Big Bird, all this stuff. Nobody's saying anything to me. And one day, I didn't feel well, and my aunt asked me, did I want to go to the hospital? And I told her yes. She took me to the hospital. 30 minutes later, she said I went totally bonkers. They're ready to psych me. My family did everything they could. They had to call my brother up to do anything else. And they told my brother that I was crazy. My brother said, my sister's not crazy. You test her for everything. And they tested me for the virus, and I wound up with the virus. I had an infection around my brain. Didn't know no one, nobody, not even myself. And I wound up in a hospice, 6 weeks to live, diapers, wheelchair. I couldn't feed myself. I could not bathe myself. That's no joke. I'm here to tell my story. And it took at least 3 months for me to figure out what a hospice was. I was like, hospice? And I had just buried my mother and my brother, and all I could do was sing, my mother prayed for me. My mother kept coming to me, and I would tell them, go get my mother, she's right over there. And they're like, she's not there. And I'm like, not figuring that she's dead. And it took like 3 months for me to get myself back together, to realize who I was. And I walked out of the hospice in 6 months. You don't walk out of the hospice. After that, I met my good friend Chena. We were put together from our case managers, and we joined the network, and we go out. We do outreach to people, especially to teens, to tell you, use protection. You never know when you're going to get this. And like the Reverend said, you take a lot of pills. I went from like 30 pills a day, drinking a gallon of water a day. And it's just no joke. Now I'm down to about 6 pills a day, once a day. There have been days that I did not want to take a pill. I was like, I don't care. I was already close to death anyway. You know, I'd rather just die. But I'm still here. Thank God I'm still here. Thank you.
Well, good morning. I'm not going to be long. I'm going to be to the point. Is that all right? Yeah. Come on, just stretch your hand a bit. Is that all right? Come on, just stretch your hand a bit. Well, I'm not going to use the mic. I'm also a preacher, and you know, preacher has a tendency to do some things. Right. However, today I'm representing New York City Department of Health and Mental Hygiene, Bureau of HIV/AIDS, of which my areas of responsibilities are immigrants and HIV, as well as the over 50. You know, I applaud Natalie, who is very, very active and an advocate, you know, not just for immigrants and HIV, but in terms of advancing people's education around being informed about this disease. And Natalie sits on our HIV prevention planning and we're talking universal access and civil rights. I'm going somewhere with this. Because when we think in terms of immigrants, and particularly a lot of undocumented immigrants, feel and believe that they have no rights. And with HIV, this is also exacerbated even much. Not having, for many of them, being undocumented, there are certain limitations for them, particularly if they test HIV positive. There's a lot of fear, there are a lot of concerns, and I'm not going to go into the statistics, but if you were to look at the epidemiology of HIV and AIDS, we'll see that Brooklyn is the epicenter, particularly when it comes to immigrants, followed by Queens. And I've been involved with the Queens HIV network from its inception when it was under the Urban League. When we think in terms of immigrants and universal access and civil rights, immigrants do have access. And for us in New York City Department of Health and Mental Hygiene Bureau of HIV, we want people to become involved. That's why we have such things as the Prevention Planning Group, where Natalie sits on, and she sits on the Immigrant Work Group, and you don't have to be nominated to participate on the work group, because it's in the work group that the decisions and the priority areas are identified for various populations. And those areas are then written into what we call a prevention plan, which is then sent out to the Centers for Disease Control and Prevention. And we as the city are obligated to listen and to pay attention to the recommendations that are made within those work groups, as well as to put the dollars behind that. So we're talking access. So irregardless of the fact that you're not documented and you're an immigrant, you do have certain rights. One of the things that we have done that has been a priority area for us at the Bureau of HIV and AIDS is to ensure that everyone throughout New York City have access to testing. We've had the first pilot program in the Bronx, which the campaign was known as the Bronx Knows. And the Bronx is one of the first areas that, I can't quote the percentage, but it's a large increase in the number of people in the Bronx who now know their status. This campaign is going to be extended into Brooklyn next year, and I know as time goes by, it's also going to be extended into Queens. We know that Southeast Queens, there are a number of issues that are affecting Southeast Queens. We know that. We look at the data. And when we think in terms of immigrants, you know, we have been doing on the immigrant work group, doing what we call informational sessions. And what we do, what the members of the work group do, is that they bring people together to get a sense of what are some of the obstacles, what are your barriers, what are some of your challenges, and we are writing that into what we call a community service assessment, which is also going to go into the Centers for Disease and Control. And Natalie has done one at Voices Latino. When we think in terms of immigrants, language, believing that they have no access, fear, you know, these are all obstacles towards HIV prevention that needs to be addressed. We hear, and I see that included in the packet is a brief information in terms of President Obama repealing the immigration ban. What does that mean? That is so significant. That law is going to come into effect as of January. And that's going to change a lot for immigrants who are HIV positive or living with, or who are living with AIDS, who are trying to get into the country, as well as those who are here already, who are undocumented. So we need to understand some of these challenges. And we're talking access. Access to not just services, access to medication, access, we heard about the National AIDS Strategy. Immigrants do have rights. Rights to voice their opinions in terms of what is needed based on their experiences. You know, and I'm going to close here because in the event of time, and I am one that respects time, but if you have any further questions, they can be directed to me. Thank you.
I don't know why I don't learn my lesson. Every time I follow Dolores or Marilyn, I got to come up. I'm the government worker, so now I got to try to pump you up with government speak. So I never learned my lesson. But my name is Frank Musumisi, and I'm a federal investigator. And I'm with the United States Department of Health and Human Services. We have a branch called the Office for Civil Rights. And basically, I'm glad Natalie called and Marilyn called it because, unfortunately, many of you and your family members and friends don't know that you have rights. And this is universal access, the theme. And one of the things you have to know is that if you as an individual goes to a facility, let's say a hospital, clinic, doctor's office, and they receive federal funding from us, and I'll give you an example, Medicaid, Medicare, whoever receives Medicaid, Medicare, Ryan White funding, we have jurisdiction over them. So what happens is if they deny you some type of service because of your age, national origin, color, race, and in this case disability, because HIV/AIDS is classified as a disability under Section 504. I won't bore you, I know. I'm already leaning towards boring. But it's tough. But just know this, none of these facilities can say no or deny you that service. So when that happens, what you do is you come to me, or you come to our office. I say me because you see me now, I got like 1,000 cards there with my direct line, so when you call, you won't get a machine, you'll get me. Now, don't leave here saying what everybody tells me every time I go on a presentation. We'll call you. We got so many things. I sit there. The phone doesn't ring. It looks bad in front of my boss. He says, "Where were you?" I said, "I swear I was there." So please. So, you know, I got like 5 minutes. I usually could do either 5-minute spiels or an hour and a half. And the hour and a half I can't do because if I turn off the lights, you'll all fall asleep. But know this. I'll give you a couple examples of cases that we're working on now. Unfortunately, in New York, and you tell me if this is true or not true, we have no discrimination cases based on disability, on HIV. Does that mean there's no discrimination going on? No. I don't know. That you got to tell me, because nobody's calling me. So I'm thinking there's nothing wrong. Now, our jurisdiction is New York, New Jersey, Puerto Rico, and the Virgin Islands. I do have cases in Puerto Rico. One such case is an individual presented at the emergency room requesting assistance, but they found when he disclosed his HIV status, they put him in an ambulance and sent him somewhere else. So in that case, that's something blatant, because obviously because he disclosed his HIV status, they didn't want him there. And another case in Puerto Rico, one of the laws that we oversee is HIPAA. Everybody knows the privacy rule. Your medical information should stay within the doctor's office and treatment team. Well, in this case, the individual was waiting in the waiting room. The doctor came out and said, "Excuse me, I got your HIV medication right here." Wow. So cases like that, if you know something like that that's happening, please call me. I have my card. We do investigations. What we do is compliance reviews. If you're, let's say, an undocumented individual, you feel you don't want to come to me because I'm a federal investigator, you can call me and say, "Listen, Frank, this hospital here in Queens, they're not treating individuals who are HIV positive. That's all I need. I can come in, step in, and review their policies." So basically, Frank Musumisi, federal investigator, got my card. Don't leave without it. Thank you.
My name is Kyra Smith, and I work with the New York City Department of Health and Mental Hygiene in the Bureau of STD Control. I'm the program director for a program called Step Up, which stands for the School-Based Testing and Treatment Program for Urban Populations. It's a long... We love acronyms in the health department. At any rate, it's a program that goes into the public high schools. I'm hearing a lot of talk about how we need to talk to our young people about about sexual education and about sexuality. Well, we have a team of people doing exactly that every day, going into your schools, into your high schools, as many as that will allow. And we're testing them specifically for gonorrhea and chlamydia. But these are the two STDs that are inordinately affecting that age group. But you can't talk about HIV and AIDS without talking about the other STDs as well. You can't talk about these things in a vacuum. So of course, in the conversation, we're also discussing HIV and AIDS and the risk factors and how they can protect themselves. So my program goes into the high schools. During last year, we went into over 100 schools, about 111 schools in all 5 boroughs, testing educating about 25,000 students and testing over 11,000 students for gonorrhea and chlamydia, with about an 8% rate for females and a 5% positivity for boys. So you see these numbers, I don't have to tell you the numbers, they're high. But we're trying very hard as a bureau to do to help educate the younger people. We do high school students and that just out of high school age, which the YABC programs, GED programs, so that we are getting to that 20 to 25-year-old population as well. So I would be happy to take any questions regarding that. And if you know of a high school that would like to have this kind of testing or at least have workshops or discussions about sexuality and STD education, that's me.
I was 11 years old. My brother was 3. And just to sum it up real quick of how everything was living with my mother, it was crazy just growing up where we denying the situation. You know, you see somebody get sick, right? First thing you do, you don't want to call it AIDS or HIV. You want to call it cancer. You know what I'm saying? Because you're so ashamed of the virus itself. Because it's like either you got it from sexual transmitted or you've been using drugs and getting high. So those two things that you didn't want to let everybody know. You didn't want to let the church know because you're scared of the church gossip. You didn't want to know that. You didn't want the family to know because you didn't want them all in your business, only the people in your circle. And just me going to school and, you know, I had to go through that situation of not telling my friends because I was so ashamed. And I feel like the only reason why I was ashamed because my family was ashamed. I feel like if my family would spoke up about it, maybe I wouldn't be ashamed to tell my teacher or maybe tell my, my doctors or anything of that nature, you know, just to explain how I really feel. So I had to keep everything inside. And that's the hardest thing for me, just to keep everything inside. And one thing my wife knows, she knows I like to talk. You know, so just keeping that inside of me just hurt me. And just going through the stages, I remember my mother used the bathroom. And this is before I didn't even know about it. My mother was in the bathroom. And I used the bathroom right after her. And there was a spot of blood on the floor. And I was going to go wipe it up. And my mother was like, no, don't wipe it up. She was going crazy. And I still didn't know what was wrong. You know, I was about like 10 years old at the time. And she just said, don't touch it. So a week later, we was watching this movie called, I think it's called Time Out with Magic Johnson and Arsenio Hall. And basically it teach you, you know, the safe way or what not to be scared of and stuff like that. And that's where I really got the knowledge of just knowing what my mother was going through. And I still didn't hear it from really my mother's mouth. I heard it from my cousin who told me. My cousin was about probably like 10 years, maybe 11 years old, a little older than me. So just imagine a kid telling you something about your mother. And as I remember I was in the bathroom and I had to ask my grandmother, is it true? And my grandmother was like, yeah, it's true. And I just broke down. It hurt me so much just knowing that she was going to die soon. Just knowing that. So as me going to the hospital, it was Flushing Hospital, and as I recall that, when she was getting sick, still didn't have knowledge of, you know, the virus itself. But I remember when I was going to the room, I had to put a mask on, I had to put gloves on, I had to put everything on, just to protect her, because my germs would actually, you know, hurt my mother. You know, so that's what just going through those stages, and as she laid to rest in 1994. I probably was the only one in elementary to really lost his mother. At the time, everybody had a mother, I didn't. And now I'm in this ministry. I've been in this ministry 04, Christian rapping. And I have a song called Calling. Actually, it's a tribute for those who are living and also die for AIDS. And through God, I got to say, through God is what kept me sane. And I'm just here today, you know, through God, just to let you know, just to give you hope and new beginning. You know, because sometimes you don't know what state a person might be in. Maybe they might be thinking about committing suicide. Maybe they the devil got them all crazy. Maybe they just want to sleep where everybody can sleep so they feel better or think they feel better to give the disease to somebody else. That's right. So I don't know, you know, who's infected or who's going through some times where they feel like giving up, but I'm here to preach, to talk to y'all. You know, let you know that you are loved. And I pray today, right now, that whatever y'all going through for the bitterness, because it's also bitterness for somebody who's giving it to you, I pray that decease right now. Just let you know that you are loved and that we are here today. I'm here, you know, not just for myself, but for all of y'all. Just to give you my testimonies. And I know my mother didn't die in vain. I know that she gave me, you know, she gave me strength. I wouldn't be here today if I didn't have nothing to say. You know, so I just want to just, like I said, encourage every single one of y'all. If y'all don't have it, you're not contracted by it, maybe you should know somebody. I just want you to just give them new hope and new beginning and just let them know they love. Thank you.
That concludes the presentations, which were obviously very powerful, very profound, and very real. And I think this is an unbelievable panel because they had not only the depth and understanding, but they were able to get it out there. So thank you very much.